Welcome to our channel at Therapy Pathways. Thank you for joining us today. Today we're going to be talking about cognitive decline. Perhaps you or someone you know is concerned about cognitive decline. In this video, we're going to talk about what that means, who can help you, and some strategies that are associated with different types of cognitive decline. So it's important to know you're not alone. We're here to help you, and hopefully this video will give you some more information about cognitive decline and what you can do, some resources that are at your fingertips. And if you have more questions at the end of this video, please reach out to us and we will point you in the right direction, give you some answers, hopefully if we have them, and just be a supporter for you. So you're not alone, okay? Let's first start off by talking about what cognitive decline is. If you're watching this video, chances are you're concerned about cognitive decline. Maybe you already have a diagnosis for a specific type of cognitive decline. Regardless, we're just going to review the definitions of what that is, and then we'll kind of get into some more about who can help, okay? So when we talk about cognitive decline, we're talking about mental processes of acquiring knowledge, understanding through thought, experiences, and our senses. It can involve conscious intellectual activities such as thinking, reasoning, and remembering. It's all of that cognition, that thinking and knowledge and all of those things that we've acquired throughout the years. And at times, as we get older, maybe due to traumatic brain injury or the process of getting older and developing certain types of disorders and diseases, our cognition may be impaired or impacted. And so this is what we're kind of talking about today. It's important to remember as the patient or family member that you know your case best. You're your biggest advocate, so be sure to share your information between providers as you switch between, different professionals. Make sure they're aware of what's going on. We don't often get a chance to all sit down at the same table and talk about our specific clients. So you are the person who brings that information to us and shares it with us most of the time. And if you feel like something isn't right or something's not being addressed, you don't feel like you're being heard, it's important for you to know you have the power to switch providers or ask more questions. If you have concerns, just advocate and make sure that they're addressed and heard, okay? Early intervention is always best. So if you haven't been diagnosed and you have some concerns about cognition, it's important to dive into that, look into that. Here's some professionals who may be able to help you get a diagnosis, and then make sure that your concerns are heard and addressed once you get some testing done. Okay, so people that can help. Number one, we have your neurologist, a neuropsychologist, and obviously our realm here at Speech Pathways is speech language pathologist. So when we talk about a neurologist, they're the people who can help you with some testing, doing maybe a neurological exam, some lab tests, brain imaging, mental status testing. They'll help you with treatment with medicine. They'll give you some lifestyle or home remedies. These are some of the things that they can do to help, but that's not where it ends. There's also other professionals who can help. So we can also talk about the neuropsychologist. So neuropsychologists are specialists who can help assess, diagnose, and treat individuals with cognitive diseases. They can help you with your mood, any behavior associated with your cognitive decline. They work with families to provide tools and plans for daily functioning. And they help support and facilitate communication between family members, with support services, things that are going to be happening in the future as cognition may continue to decline, if it may be progressive. They are the facilitators and people that would help you in your family move forward with how you're going to handle certain things. They also assist family and caregivers with their emotions by helping to maintain their loved one's quality of life. And so we understand that it's not just the individual with the cognitive disorder. The family and caregivers are also being impacted, and neuropsychologists can help with that. And the meat of this presentation is really to also talk about speech language pathologists. Well, we're not the only ones who can help. Obviously, at Therapy Pathways, this is a big thing that we do. Um, we can provide therapy services. There's obviously things called evidence based practices where research has been done on many different types of cognitive disorders. And depending on what type of cognitive disorder you end up being diagnosed with, we would utilize specific evidence based practices to support that in a therapy scenario. Um, so it's also therapy is also based off of person centered care. So as the patient and family members, you basically let your therapist know, like, hey, this is what we want. This is what we're looking to improve on. And your therapist can help you work towards those goals. So when you're talking about cognition, there's different areas of cognition. And you'll see here in the slide, there is attention, memory, problem solving, executive functioning, and higher level thinking skills. So your therapist can help you in any or all of those areas, depending on um, what area you're having the most difficulty in and what your goals are. SLPs also help patients stay as independent as possible. Um, some of these cognitive disorders, like we discussed, are progressive. And so sometimes they may end up declining and getting a little bit worse progressively, right? And so it could be that you may not have eating issues or concerns in the beginning, but later on, you may have some concerns about eating safety. And swallowing is something that is within the scope of practice of a speech language pathologist. And they can certainly help you with any of those concerns. If you're choking during meals, if you're coughing a lot during meals, they'll be able to help you. Okay. So make sure that you let them know if those are some issues that are arising. Okay. Um, and then also, your SLPs will help you learn and practice important information. Um, you'll see in this next slide here important information. So maybe you're starting to take some medication and you need to be able to um, prioritize the days of the week, the morning versus afternoon, what you're taking, scheduling appointments, setting reminders, all those daily living type of skills. As your cognition declines, will become a little bit harder for you to do. But with therapy and the help of an SLP, we can help implement some strategies to help you remember. And also that feeding and swallowing piece as well. Right now, it comes a little bit easy, but as the cognition declines, it could be a little bit harder. And so, those are things that, we can also help with. One of the big things that speech language pathologists also do is help families create memory books. So it can help in recalling information like personal memories, family members' names, and things like that. Um, it also helps the person that has the cognitive decline be able to share their experiences with others by showing pictures and having something with visuals that they can show. And you can have words in it and customize it and personalize it. So this is something that's really interesting and something that SLPs can help with. Some strategies that you may learn from SLPs. Um, For example, you may hear the word space retrieval. This is evidence based strategy that is used for recalling learned information over a period of time. And so you can kind of think of like long term memory and just think about, um, remembering something over that period of time. So this is something that evidence does back up and support. And so this is something that an SLP may bring up and say, hey, this may be something that you would be able to do. You're, a good candidate for this type of therapy, and they may implement something like this. The message communication is just a strategy for carers. of those with dementia. So maybe you have been diagnosed with specifically dementia. And when you look this strategy up, it will give you some specific things you can do as someone who takes care of someone with dementia and help be a better communicative partner with them and give you some ideas of what to do. Also, there's something called lexical retrieval. It's the process of getting from a concept to a spoken word. And so sometimes maybe someone with cognitive decline may have an idea of what they may want to say, but they might not have the word specifically that they want to say. And so this type of therapy helps them to work around that breakdown and get to the word that they're trying to say. And so this is by no means an exhaustive list. These are just some to show that there are some things in SLP's pockets that they have that they can pull out to work with those with cognitive decline and specifically help them in certain areas that they're having difficulty in. So, of course, you can always reach out to us depending on where you live. We're in Florida, so if you're living somewhere else, you can also contact a SLP near you. This website here, asha.org/profind, will help you find a therapist near you that you can help get some more information from. And ASHA is the organization where speech language pathologists get their credentials from. And so this website is very helpful. If you just go to asha.org and want to find out more information, you certainly can. So we're almost towards the end of our presentation, but this is some important stuff that you can do to help those you love with cognitive decline. So you want to help maintain a normal level of function for as long as possible. So some things you can do to help that is helping to maintain the sleep patterns, having a healthy diet, regularly exercising, doing some cognitive stimulation, and socialization. There are some more tips for communicating with individuals with cognitive decline that I kind of just jotted down here. You want to reduce the pace of the conversation, so allowing for ample time for them to communicate back to you. You don't want to rush, so you'll slow down your rate of speech as well, just making sure that they're picking up everything and it's not super fast. Then you'll also want to make sure that you eliminate any distractions because that can be a little overwhelming. Keep things simple so you can discuss one topic at a time, give one step directions. You don't want to overwhelm them. Um, have an empathetic attitude. It helps reduce the stress while communicating. So, obviously, if you're frustrated, that might not make the communication or your communicative partner very open to wanting to communicate. So we want to make sure that we reduce that stress if possible. And you can also reduce that stress by offering choices. So oftentimes open-ended questions are a little bit harder to answer. And so if you give offer choices, that can be a little more helpful for others that you're communicating with if they have cognitive decline. At the end of the day, we just want you to know that you're not alone. As a caretaker or an individual with cognitive decline, um, it can get a little bit tough sometimes. And there are resources available to help support you along the journey. Just reach out to someone in your area, reach out to us if you're in our area, or if you can't find anything else, we'll definitely point you in the right direction. So you can learn some more strategies. You can get in contact with someone about therapy. And there's also support groups that you can join. You're definitely not the only ones going through this, and we're here to help support you along your way. So thank you for watching our channel today. We hope that some of this information is helpful to you, and just know that we're here for you if you need us, and you're not alone. Thanks, guys.